Have you ever thought breathing, the very essence of life, when taken to extremes, can land you into a medical emergency? Well, this is often seen in dental practice, where patients, trying to conceal their fears and anxiety, unwittingly resort to rapid and deep breathing. So let's see how this seemingly innocuous act can transform a routine dental procedure into an unexpectedly challenging task. Hello everyone, welcome to the series on medical emergencies in dental practice. Today I will be discussing about hyperventilation. Hyperventilation can be defined as ventilation in excess of that required to maintain normal arterial oxygen and carbon dioxide tension. It can be caused by an increase in frequency or depth of respiration or both. The common etiological factors include extreme anxiety, pain, metabolic acidosis, drug intoxication, hypercapnia, cirrhosis, and organic CNS disorders. The increased rate and depth of respiration leads to a series of changes in our body, ultimately resulting in clinical features such as tingling and paresthesia, carpopedal tetany, cramps, and possibly convulsions. In hyperventilation, there is increased exchange of oxygen and carbon dioxide by the lungs, leading to excessive blowing off of carbon dioxide and decreased arterial carbon dioxide tension. This leads to an increase in the blood pH, that is respiratory alkalosis, decrease in ionized calcium levels, and increased neuromuscular irritability and excitability. However, here's a question to think about. There is increased breathing during exercise also, but it does not lead to respiratory alkalosis. Well, during exercise, there is increase in metabolism and increased arterial carbon dioxide tension, which restores the blood carbon dioxide levels to normal. Now, coming to the clinical manifestations, the normal respiratory rate is 14 to 18 breaths per minute, and in hyperventilation, it reaches to 25 to 30 breaths per minute. The clinical manifestations can be grouped as per the different organ systems affected. Starting with the cardiovascular system, there will be palpitations, tachycardia, and precordial pain. The neurological manifestations include dizziness, lightheadedness, and disturbance of consciousness. The respiratory symptoms include shortness of breath, chest pain, and dryness of mouth. The gastrointestinal findings include globus hystericus, which refers to a subjective feeling of a lump or foreign body in the throat, and epigastric pain. The musculoskeletal system will present muscle pain and cramps, tremor, stiffness, and carpopedal tetany. The psychological symptoms include tension, anxiety, and nightmares. Now, coming to the management part. The primary goal is to raise the blood carbon dioxide levels, which ends most of the symptoms. Terminate all dental procedures and remove any foreign object from the patient's mouth. Any presumed cures, such as syringe, dental handpiece, or forceps, should be removed from the patient's line of vision. Provide reassurance and calm the patient. Have the patient breathe slowly and regularly at a rate of about 4 to 6 breaths per minute if possible. In case of respiratory alkalosis, ask the patient to rebreathe exhaled air as it contains an increased concentration of carbon dioxide. Instruct the patient to cup his or her hands in front of the mouth and nose and breathe in and out of it. This also warms patient's cold hand and helps in alleviating the symptoms. A full face mask or paper bag can also be used. However, administration of 100% oxygen is not indicated as it further decreases the arterial carbon dioxide levels. If hyperventilation continues, drug administration may be required to relieve patient's anxiety and slow the rate of breathing. In such a case, benzodiazepines are the drug of choice. These can be administered intravenously, titrated at 1 ml per minute until the patient's anxiety is reduced. For intramuscular administration, midazolam is preferred over diazepam, since diazepam is not water soluble and burns when injected intramuscularly. Oral administration of diazepam may be considered, as the latent period for diazepam is actually longer after intramuscular administration. Oral dose of 10 to 15 mg diazepam usually terminates hyperventilation within 30 minutes. The vital signs should be monitored, and once hyperventilation stops, the patient should be rescheduled with plans to use stress reduction protocols in future visits. That was all about hyperventilation. However, it is recommended to refer the updated and standard guidelines regularly to keep yourself up to date with the emergency protocols. In the upcoming video, I will take on another medical emergency and its management. Till then, if you found the video helpful and informative, then do like the video, share it with your friends, and subscribe the channel for more such content. Also, you can download our app for more details and notes on dental and medical topics.